Thank you for joining us for the first of our three-part COVID vaccine education series. We will begin shortly.
Lee, I'm not sure if you saw what Daphne wrote in the chat.
Well, good afternoon, ladies and gentlemen, and thank you very much for joining us for our first of our three-part COVID vaccine education series. You are in for a treat. I am going to turn the session over to Lynn Meadows, our Director of Student Health Services. Lynn?
So good afternoon, everybody. We are super excited. Happy Friday, first of all. We are so excited to bring to you a three-part series, not one, not two, but a three-part series featuring 5 renowned, amazing presenters who we consider and who are considered experts on COVID-19. We have posted their bios for you to see. One of the presenters is our very own medical director, Dr. Yolanda Wimberly, who you will hear from on Monday and Wednesday in our sessions. And we'll talk about the other upcoming sessions at the very end of this session. But the purpose of our series is to share information and to provide an update on COVID, to discuss preventive strategies, vaccine safety, and then on the last series, we'll host an actual Q&A where you will have an opportunity as an employee and as a staff member to actually submit questions for us to present at that Q&A session. So today is really our kickoff session. Again, we have 2 amazing presenters, Dr. Kelley Carroll and Dr. Carlos Del Rio. We are super excited to have them to join us. I think there are a couple of housekeeping notes just to let you know that this video is being recorded. So if your colleagues are not able to join, they will be able to come back and see it. Just to give you, again, the bios are available to you to read in full depth on Dr. Carroll and Dr. Del Rio and all of our presenters. But Dr. Carroll is the Executive Vice President of Ambulatory Care Services, as well as the Chief of Ambulatory Medicine at Grady Health System. Dr. Carlos Del Rio is the Executive Associate Dean from the Emory School of Medicine and at Grady Health System. So we are excited to kick off this session. This session has been entitled The New Year of COVID-19, the State of the Pandemic. So without further ado, I'm going to ask Dr. Carroll to start.
Thank you so much, Lynn, and thank you everyone for inviting me to be here in this session. It's so important to talk to our teachers at this time. So I want to start with a moment of silence. At this point in the epidemic, we have 500,000 deaths, more than 500,000 deaths. And so if we could just have a brief moment of silence for 10 seconds for those who lost their loved ones in this pandemic. Thank you for that. I just wanted to acknowledge the suffering that's happened this last year, but on the other hand, I want to look towards the future. The good news is that we've given almost 100 million doses of vaccine. By next week, it'll be over 100 million, and that is just a phenomenal accomplishment. And I'm so glad you guys get to hear from Dr. Del Rio. He's one of the world's expert on COVID-19 and expert on the vaccine development. So you guys are really in for a treat to hear from him. I've called myself the opening act, the warm-up act. If you all remember our lives before COVID, when we used to go to concerts and you'd have the warm-up act and then the main event. So I'm the warm-up act. And so really what I want to tell you all about is sort of our experience here at Grady and our story of how we've implemented this vaccine program over the last 3 months. So I know there's been a lot of controversy about who gets a vaccine first. Should it be this group? Should it be that group? And there's always been a lot of back and forth. And I really understand the challenges this has that our governor and our state has had, because I had to do the similar thing in the beginning of December when we had to ask ourselves, okay, well, we can give it to our healthcare workers, but who goes first? We don't have enough doses for everyone, and even if we did, we couldn't give it all in one day. So how do you prioritize? And that prioritization is very, very challenging to do. So I know everyone's been waiting and waiting. When can teachers go? But just understand how hard it is to do that kind of prioritization when so many people want this life-saving vaccine. So once we decided how to do prioritization, the next thing Dr. Del Rio and I did was a series of these sort of events. So we did lots of webinars, we recorded them, distributed them to employees, healthcare workers, and medical staff on what to expect about the vaccine. Of course, Dr. Del Rio, being the expert, could answer any questions, and I sort of was there to talk about process and to just build trust with our healthcare workforce. So this sort of event is critical. So definitely tell your colleagues who weren't able to join live, to listen to the broadcast, to come to the next upcoming sessions, because this is a critical part of the messaging and outreach and education. So you can just debunk the myths. There's so many rumors, so many myths, and these are the opportunities we have to debunk all of these things and hear really what is the true science. Another really important part of this sort of initiative as you guys move into vaccinations is hearing from people who've been vaccinated and about their experience. Look at the people who are trusted influencers in your schools and in your areas, and hearing from them is really powerful. So when someone hears that their colleague who they trust has gone through it, it really impacts them and helps them come to the decision to make get their vaccine done and make their appointment. And the focus really should be on building trust. There's a lot of distrust in our society right now on every level, and lots of different groups for lots of different reasons. But you all need to build that trust, and these sort of events is really the key to doing that. Another thing you have to be mindful of as you go on this journey is making sure your access is equitable. We all hear about health equity all the time and about health disparities and differences in access, that certain groups are getting access to the vaccine, certain groups aren't. And part of that is because of digital literacy challenges. And so there's some groups who are just not as savvy to quickly click on a website and sign themselves up. And so many of us have been on Zoom meetings for so long, this is second nature. But other people, navigating the internet and making those kind of appointments can be challenging. So don't forget about that population of your employees who may have a little harder time, and they generally are not going to want to speak up and say that they're having difficulty. So make sure you remember them and bring them along and have different ways that they can reach out and get help and make their vaccine appointment. You don't want any barriers. So look for any sort of barriers to making vaccine appointments and try to get rid of those barriers. So far, we've given over 17,000 doses at 6 different sites. So we have our main hospital here in downtown Atlanta, but we have community sites all over both Fulton and DeKalb County that we're vaccinating our patients. So as we've given 17,000 doses, a lot of experience in hearing lots of different questions and concerns. Probably the first question that comes up is side effects, and what will happen after I get my vaccine? What do I expect? And so what will happen when you get a vaccine, and this is any vaccine, is your body responds to it. It's called reactogenicity. And so there's always some symptoms, and they're normal and they're to be expected, and they're a sign that this immune system is turning on and responding to the vaccine. So it actually is a good sign. So it's usually local things like arm soreness, maybe a little bit of redness around the injection site. Also can have a systemic symptoms like body aches, maybe a low-grade fever, some chills. And these reactions only happen for a few days. They are not long-lasting and they're not permanent. There's been a lot in the news about the allergic reactions that can happen. With our 17,000 doses, of course, we've had a few of those. They're very easy to treat, easy to manage. No one's had any harm from our vaccinations. We give them a dose of Benadryl, they go along their way and they're fine. So definitely sometimes you will see things and they become overblown. In our experience, yes, very few people have had these reactions, but they're extremely treatable and people go on and are fine. We do have now, some of the trials have been going on for almost a year now. So a lot of people are concerned about long-term. Well, there's been, almost 100 million doses given, even worldwide more than that. And so there's a lot of experience now. And the last question I often get is, well, do I still have to wear my mask? The answer is in public, yes, you do still need to wear your mask. The CDC does have some more guidance on that just came out actually this week about some changes people who are fully vaccinated can start taking advantage of in their daily lives. So yes, you still need to wear your mask in public, but there will be things that fully vaccinated people are able to safely do. And I'm sure Dr. Del Rio will dive more into that. So with that, I appreciate the invitation to be able to tell the Grady story of our vaccine journey. And I just congratulate Fulton County on this endeavor and doing this event. Thank you so much. I'll turn it over to Dr. Del Rio.
Thank you, Kelley. That was a great presentation, a very, very good start of where we are. And I want to say again that Grady, as a trusted member of the community, has done a great job of vaccinating, and we continue to be interested in getting everybody vaccinated because nobody's safe until everybody's safe in this pandemic. I want to tell you a little bit about the vaccines, and there's a lot to talk about, but I'm going to try to limit my comments to a few things, given the title, a new year of COVID. So I just want to reflect, as Kelley did, about what this year has been. I put some dates here that are significant. When WHO, December 31st of 2019, WHO alerted about a new outbreak. Then you have the genetic virus, the genetic of the virus identified, the new virus. January 20th, we had the first confirmed case in the US in Washington State. And by February 2nd, we had the first US death. And you can see other events here, the first case in New York. Yesterday is a year anniversary when WHO declared COVID and officially a pandemic. You can see here that by March 26th, 1,000 Americans had died of COVID. By April 24th, 50,000 Americans had died of COVID. On May 15th is when Operation Warp Speed was launched. This is the beginning of vaccine development. And by May 27th, 100 Americans had died. And then in June 20th, something very important happened. The government made purchase agreements with Pfizer and Moderna for making vaccines and having them available contingent on successful phase 3 trials. And I think, honestly, we did a lot of mistakes in this pandemic. The federal government did a lot of mistakes, but this wasn't one. Making sure that vaccines would be available the moment phase 3 trials were known was a critical component in getting us where we are right now. But by late September, there had been now 200,000 deaths. You can see here that President Trump got COVID. And then by December, the FDA granted emergency use authorization to the Pfizer vaccine. By December 14th, 300,000 Americans had died. Then by late December, variants started to emerge as a concern. By January, 400,000 Americans had died. And then by September 22nd, 500,000 Americans have died. So I want to emphasize what Dr. Kelley said, Dr. Carroll said, which is over 500,000 Americans have died, and this has been in a year. This is incredibly tragic, and we need to really acknowledge that. And the people that have been suffering the most this pandemic, both physically as infected and economically, have been people of color, and have been African Americans, Latinos, Native Americans, and people who are poor. And I think that's really something that we all need to remember, because there's not only, health pain, there's also economic pain in this pandemic. You can see some numbers here. I'm not going to go into this. I'll make the slides available to you. But this is what the pandemic looks like in the US. This is the curve right now. And the good news is, after having a huge peak in January in cases, we're starting to come down. But let me just say that 58,000 new infections is still a lot of cases. We want to get that number below 20,000, ideally below 10,000. And you want to bring the number of deaths below 1,000. We're getting there, but we still have a ways to go. And we're very worried about this little thing. See, it's beginning to look like this, that slowness is not happening anymore. It's beginning to be a little stalling. This is the national picture. We're not out of the woods. Red is bad. And this is where Georgia is. We're number 5 in national cases right now. This is the deaths. And again, we're not out of the woods. Red is bad. You can see how much red there is, and Georgia's number 6. So these are our curves here in Georgia. And to summarize it, we're number 5 in cases. We're number 2 in US deaths per 100,000. And we're number 2 in COVID inpatients. So Georgia's still not in a very good place. Atlanta is doing better though. And we're doing worse in Georgia and rural communities and in places like Atlanta. Atlanta is doing much better. This is from the Atlanta Strong website. This is the latest sheet with data. And you can see in Atlanta that we are now down in cases in yellow and getting down to green. In test positivity, we're in green, and hospitalizations, again, we're in yellow. So all this in Atlanta, data looks so much better that we're doing better in Atlanta than we are in rural communities. This is the CDC's indicator of, this is a table that was put for schools about, opening and the different categories. And again, we want to see our counties to be all in blue or all in yellow. And we still have a lot of counties that are still in red. So we have a ways to go to get our county numbers down. Bottom line is we need to continue wearing our masks. So I put this because we're the home to Delta Airlines. And everybody that has gone on a plane know that the most dangerous time of a flight is the takeoff and the landing. And this is when you have to pay a lot of attention. And we didn't do very well when the COVID plane took off. We didn't do a good job. But now we're landing the COVID plane. And I don't know how many of you have been in a plane, but when you're flying, the captain doesn't say, oh, we're almost there. It's time to take your seatbelt off. You don't need it anymore because we're almost there. Well, that's in a way what we're doing. Many states are saying, oh, we can take our mask off. We can open everything because we're almost done. Well, I tell you that I'm very pleased that Governor Kemp has said we're not doing that. And you can see here Governor Kemp saying we can't let our guard down. We're going to keep doing what we're doing for another month or 2 to get closer to herd immunity. It just feels like the light's at the end of the tunnel. So yes, we're landing the plane. Everybody has to continue wearing their mask because this is how we get back to normal. We get back to normal through continuing non-pharmacological interventions, which are wearing a mask, socially distancing, limiting gatherings, proper ventilation, and vaccines. And the combination of these 2 things is what's going to get us to where we want to be, hopefully this summer. So what is herd immunity? I get this asked a lot. So about 900,000 Georgians are fully vaccinated. About 900 Georgians have had natural infection. So that means about almost 2 million Georgians are either immune because they've been vaccinated or they had the disease. That's about 18% of the population. In order to get to herd immunity, we got to get to about 70 to 90% of the population being either infected or vaccinated. And how does that work? Well, you can see here the blue dots are the people that are, infected. That are unvaccinated. The black dots are the people that are infected. The yellow dots are the people that are vaccinated. So let me play the video. If you got an infected individual and everybody here is susceptible, what happens? Rapidly the disease spread. But as you start getting more and more people vaccinated and more people protected, even those people see here when we get to 95% or 80%, 90%, there may be little spread of the disease, but everybody here works as a barrier for everybody else. And eventually, then the disease doesn't spread. Even those blue people here that have not been vaccinated are still protected. And this is what we call by herd immunity. In other words, not everybody needs to be infected or vaccinated, but a good number of them need to. So where are we in Georgia? Well, as I said, we're not doing very well. Pale is not a good place to be. And you can see that we are way down here. We got to get more people vaccinated. Several things have limited vaccination. One of them has been access. I think it's really good that mass vaccination sites are being developed, like, for example, Mercedes-Benz Stadium, where you can get vaccinated over there. But again, we need to be sure that people have access, that people can go, that people have confidence, that people can book their appointments, etc. Now, let me show you how useful, how great these vaccines are. Of all the people that have died that we talked about, 80% of those that have died are over the age of 65. Right now, if you're 65 or older, your chance of dying of COVID is 1 in 132. You get the vaccine. If you get the vaccine, once you've been fully vaccinated, 2 weeks have gone by, and now you're protected, your chance of dying of COVID after vaccination is less than 1 in 23,000. Okay, just hear me now. 1 in 132 versus 1 in 23,000. I mean, that is pretty good protection. But not only that, the vaccine also protects against symptomatic disease, transmission at home. So the vaccine also protects you. 2 doses of the vaccine and 1 dose of the Johnson & Johnson vaccine will protect you from transmitting to others and from getting infected. Now the variants, why am I concerned about this? Because some of these variants, like this one, the B117, which is the UK variant, is more transmissible than the normal COVID, and it's more contagious. And you can see that the state that has the worst number of those variants is Florida. Well, we're right next to Florida, and we also have a big problem with that. So in our state, we're in a race between vaccines and variants. And the sooner, the faster we get people vaccinated, we're going to win that race. So I know there's a lot of questions, and people have questions. And last week I wrote this paper that I'll send it to Lynn so you can have it, because it's open access, trying to answer questions. You know, which vaccine is best? How do we prioritize them? How to protect myself? You know, what do I do, etc. I'll send you this because a lot of information is there that I think will be useful for you. So what can I say? I can conclude by saying that, you know, yes, COVID has been horrible. A lot of deaths, a lot of economic suffering. I think the disproportionate impact on minorities and the poor is very real, and it's bad. I think this is the best of times. We have vaccines, but this is the worst of times. We have variants, and we have premature lifting of restrictions in many states. The US was clearly not prepared for a pandemic of this magnitude. I think we need to be clear that the recovery is going to be slow, and we're going to need resources, but we're also going to need a lot of compassion. All of us are going to have friends, relatives that are going to have lost people, have lost relatives, friends, and you know, people are going to have post-COVID PTSD. We need to be aware of that. But we'll also, as I said, we're not going to be safe until the whole world is safe, and it's going to take some time to do that. I want to say a good friend of mine did a lot of the slides. Her name is Amber Schmetke. And if you don't subscribe to her newsletter, you should. This is the website, and you should try to get her newsletter. And finally, you know, last January, Dr. Manning, my colleague, and I did this. You know, I called Tyler Perry and I said, Tyler, I want you to get the vaccine, and we can tape you getting the vaccine so we can help African Americans, you know, get confident with the vaccine. And he said, Dr. Del Rio, why do you think I want to get vaccinated? I still have a lot of questions. And I said, okay, let's do something. Let's sit together and I'll try to answer your questions. And if after I answer your questions, you feel comfortable, you'll get the vaccine. So Tyler put together this YouTube documentary that was put in the air on BET, on Black Entertainment Television. And it's also available on YouTube. And I would really encourage you to watch it. It is really well done. And I think it really tries to answer a lot of the questions that I'm sure you and your relatives and your community and your friends will have. So please pass it around and let other people see it. And with that, I'm going to end and happy to answer any questions.
So thank you so much.
And Lynn, and I'll send you the slides so you can pass them to people, okay?
That would be great. We will post that definitely on our website. So I just want you to, if you will, Dr. Del Rio, since we don't have an opportunity for our audience to ask questions for this session, I do want our audience to know that for our part 3 session that's going to be held on Wednesday evening at 5:30, that is absolutely going to be an opportunity for you to post your questions or get your questions answered specifically. What we wanted to do today is to set the stage, but knowing some frequently asked questions already, I want to kind of pose some to Dr. Del Rio. And then, as I said, at the very end of this presentation, we'll have an opportunity to share that link with you. And so for our Monday session and our Wednesday session, we'll ask some of your questions. But Dr. Del Rio, can you talk a little bit about the 3 different types of vaccines that are available now?
Sure, Lynn. Let me just say that there are 3 vaccines right now that have received emergency use authorization. One produced by Pfizer, one produced by Moderna, and one produced by Johnson & Johnson. The Pfizer and Moderna vaccines are mRNA vaccines. They require 2 doses. They're fairly similar. The Johnson & Johnson vaccine is a vaccine that is an adenovirus vector vaccine, and it requires only 1 dose. The 3 of them do pretty much the same. They take a little bit piece of the genetic material of the virus that encodes to the spike protein. But how they deliver it to the body is different. The mRNA vaccines take that genetic material and deliver it through what we call an mRNA technology. And that's a little bit like a UPS man, right? It's just somebody who's going to be able to carry that and put it inside the cells and let the cells then do what they need to do. The adenovirus vector technology uses a cold virus, an inactivated cold virus called adenovirus, to do the same. The adenovirus then carries that genetic material into the cells, so the cells start producing antibodies against the spike protein. This technology has been very effective and allows the body then to produce antibodies against the spike protein. And it's that antibody, that technology that protects you. Several people have said, well, the data on the mRNA vaccines looks better because they got better protection. You can't really compare them because they weren't studied at the same time. But you can say, the 3 things you can say is the 3 vaccines are very, very good in protecting people against death, and protecting people against hospitalizations, and protecting people against severe disease. So in my mind, if you want to protect people against death, hospitalization, severe disease, any of the vaccines are good. And I would recommend, and I have recommended to relatives, regardless, the best vaccine is the vaccine you can get into your body, you can put into your arm.
Thank you for that, Dr. Rio. Dr. Del Rio, would you just expand a little bit and share a little bit more about, in terms of the various vaccines, if there are any considerations that we would need to think about in terms of maybe special conditions or things like that? Any considerations that you might want to, that just all of us as staff members, maybe with various conditions, that we may need to consider?
Well, I don't think so, Lynn. I mean, I think that probably one thing I would say is if you are probably you're over the age of 60, of 70, maybe the Moderna or the Pfizer vaccine, the mRNA vaccines may be theoretically a little better. And in fact, the Pfizer vaccine may be a little better than the Moderna vaccine. But getting those down to those nuances, I think, is really hard. I would say at this point in time, I don't want to make a lot of distinctions. I think ideally any vaccine is good for anybody. If you have ample supply of vaccines, I would probably say, the people that responded the best to the Johnson & Johnson vaccine are people under the age of 60. So maybe younger people ought to get that. People over the age of 60 ought to get the other 2 vaccines. But the reality is the difference is so minimal that I would say, just again, as I told somebody the other day, a vaccine in your arm is better than no vaccine.
That is a great response. So Dr. Del Rio, we're hearing and have heard different things about if you have had COVID-19 and you want to get a vaccine. Talk to us a little bit about that. Is there a period of time that we need to wait? So if you can talk a little bit about, if you've had COVID, what you need to do with regard to what are the recommendations? So
a couple of things. If you had COVID and you've recovered, you certainly have a certain degree of protection. And how long that protection lasts for, it's unclear, but you have some protection. It's not as good as the vaccine, but it's some protection. Because you produce antibodies against the virus, we don't want you to get the vaccine in the first 90 days after you had COVID. because if you get the vaccine in the first 90 days, it's possible that your immune system will actually inactivate the vaccine. So we want to pass at least 90 days. And it's not a problem because you won't get COVID in those 90 days because you're protected by having had COVID. The other thing we learned is that if you're going to get the Pfizer or the Moderna vaccine, people that have had COVID, the first injection they get is as good as the second one. In other words, their body, it's almost like COVID was their first vaccination, and this becomes just a booster. We still recommend you get 2 doses, but the point I'm trying to make here is that you frequently hear people say, after my second dose, I really got chills and I didn't feel good and I have felt wiped out, etc. If you've had COVID, you're likely going to feel that after the first vaccine. Now, I want to talk a little bit about that. We call that reactogenicity, which is, after you get a vaccine, your immune system wakes up. And when your immune system wakes up and starts producing antibodies, you are likely to have fever, chills, not feel well, for a day or 2. It's totally normal. It's a good response to the vaccine. And in fact, it goes away quickly. And if you feel like having that, you should, you can take some Tylenol, you can take some Advil, and you should be fine.
Thank you for that. So Dr. Del Rio, we know now that obviously school personnel are now eligible to get the vaccine. And initially it was those that were 65 years and older and caregivers and first responders, et cetera. And we just recently, we know that the state opened up the eligibility for other groups. Can you talk a little bit about the additional groups now that are eligible to take the vaccine?
Well, it changes almost on a day-to-day basis, but what the governor said, starting Monday, anybody over the age of 55 will be able to get the vaccine, as well as anybody with a series of conditions that when I look at this list of conditions, I told Dr. Carroll, that's pretty much everybody we take care of at Grady, right? Because you look at the list of conditions and it's everybody we take care of. But I'm really pleased that also teachers have been included, because I am, while I will say very clearly that I don't think vaccinating teachers is a requirement to open schools up, I think it's really important that we vaccinate teachers for safely open schools. So the sooner we can get teachers vaccinated, the safer schools are going to be. And again, I frequently talk about the Swiss cheese approach, right? It's not one thing that protects you, it's all these different things together. So I'm really happy, and again, I want to really emphasize and encourage teachers to get vaccinated. You are valuable in our society. Opening schools is such a critical thing for the economy to reactivate. We know that if we don't open schools, the economy doesn't reactivate. I mean, I have so many colleagues that say, I can't come to work, nurses, etc., thinking about quitting because they can't be doing homeschooling and their work. They have to do one over the other. But at the same time, I want to get kids back in school because kids deserve education. And in this pandemic, we got to really do something to catch up for the lost time.
Thank you so much for that, and we certainly agree. I think the last last set of questions have to do with once looking forward, if you will, and starting to vaccinate, I should say it that way, the staff and school personnel. What is the newest information with regards to pediatrics and students, or the school age group getting vaccinated?
So Pfizer and Moderna have completed their studies down to age 12, and pretty soon we'll have some data that will help us to know about that. And then they're going down to age 6. So I think that by the fall to early January, we should be able to be vaccinating kids as well. I want to also emphasize, we haven't talked about this, but there's a huge benefit now of vaccination. CDC has said that if you've been vaccinated, if you've been exposed to somebody, you don't need to quarantine. And second, most important, that I like the most, if people who are fully vaccinated can gather indoors together without a mask. What does that mean? Well, my wife and I are fully vaccinated. The other day, we hosted another couple that were all fully vaccinated. We had dinner in our house. It was a small group, but still, we hadn't had anybody over for dinner in a year. It felt so good to be able to meet with people in person, right? So there are some benefits of vaccination, and one of them is hopefully slowly getting back to a more normal life. I tend to forget what people look like. The one thing I like about Zoom is I can see you without a mask. I know what your smile looks like.
That is so true. Going back to, again, the vaccine, and someone just texted me this question and said, this is a burning question, Lynn, will you please ask this question? So if you are to have taken the Moderna or the Pfizer vaccine, and we know those are 2-dose vaccines, and somehow or for some reason you missed that second dose, what are the recommendations with regards to that?
It's just really, really important question. You know, you can wait up to 12 weeks to get your second dose. So it doesn't need to be right when the vaccine is, so you missed it at 28 days, get it whenever you can. I mean, you can wait 3 months and it's totally fine.
Okay, awesome. So piggybacking on that, what you just said, so if there is a delay, regardless of the time frame delay, is there any opportunity or any time that is right now that it's recommended that you have to start the series over?
No. At this point in time, nobody's saying we start the series over. You just get your second shot. And you know, if you only got one, you still have some protection from one. But you know, the doses are not different. They're exactly the same one. It's not like there's one vaccine for dose 1, one vaccine for dose 2. It's the same vaccine. So if you already got one dose and you missed whenever you were going to get it, you still have time. Go ahead and get your second dose.
Got it. So Dr. Del Rio, I know that having served as a vaccinator now for a couple of months, helping to give vaccines at the Mercedes-Benz Stadium, one of the things that we do is obviously everyone has to have a consent form, but on the in addition to the consent form, we've been giving individuals information from CDC about VSafe and the importance of signing up for VSafe. Can you talk a little bit about the VSafe initiative? And that's V as in V, right, audience, and the word safe.
So when you sign for VSafe, you'll be getting text in your phone asking you about how you're feeling. CDC is using that to capture information about how people are responding to the vaccine and side effects that we didn't pick up in the clinical trial. I also like it that this thing sends you a text saying it's time for your second dose, so it reminds you. But VSafe is being used, for example, to monitor pregnant women who received the vaccine. And to get us more information that we all need to understand better how these vaccines are performing in the community.
Awesome. So we talked a little bit just a few minutes ago about getting the vaccine late or later. Let me ask that question the opposite way. What are the recommendations? Is there any recommendations with regards to getting it earlier? So with regards to, for instance, Pfizer, the recommendation right now is after you take your first dose, 21 days, Moderna, 28 days. What are the parameters around if something happened where someone had to or needed to take it a couple of days earlier?
A few days is okay, but we don't want it to be, it's better to take it later than earlier. So in fact, what we've done at Grady, because we don't want to have 2 different dates to give second appointments, we actually are giving Pfizer or Moderna at 28 days because we just can't give it different timings and appointments. We're giving everybody an appointment at 28 days, which is fine. So later, in my mind, if somebody says to me, look, I need to travel, go visit somebody, and I'm going to miss my appointment, but I'll be back in a week, then get it when you come back.
Thank you for that. But a couple of days before, if extenuating circumstances is just fine. You know,
I tell you, I had a colleague that, you know, was supposed to be on call and on one day, and you know, her 21 days exactly was on a day that she couldn't do it. She got it at 19. That's fine.
Thank you so much. And now talk a little bit about, there's been questions about, well, I was able to get an appointment at one site and I've started with the Pfizer, but I can't get back in. So can I go to a different site and get another vaccine? So talk a little bit about the vaccines and those recommendations with regards to once you start a series, how you need to proceed from there.
You know, in general, mixing and matching is not a good idea. CDC has said you can do it, but we really haven't studied. So if possible, get the vaccine you got. Now, if if the only option is get another vaccine of another type, that's okay. It's better than nothing. But as I said, there's a lot of controversy about that. And honestly, the problem is we don't have much data, right?
Exactly. So that's what we are saying. And what we've heard is to stay within the series that you start with. What you start with, you finish with.
Yeah, exactly. And this is just for safety more than anything else. And, you know, that's how we develop the data. And for me, you know, going with the data is the best thing we can do.
So thank you for that. So Dr. Del Rio, based on all of the things that you've shared, and you have shared some wonderful, great scientific-based information, what are your last takeaways or something that you would want us to take away from this series based on your presentation and the comments that Dr. Carroll made?
You know, I tell people that be grateful that science has given us vaccines this quickly. I'm looking forward to the end of COVID. The moment I was able to get vaccinated, I got vaccinated. I encourage all my family members and my friends to get vaccinated. I want to be sure that our community is not, I told you, show you the data, Georgia's number 50 out of 50. We're the lowest state in percent vaccinated. We got to do better. Let's all work together. And, you know, I want those vaccination sites to say we're overwhelmed. There's too much demand, as opposed to saying, oh, people are not coming up. So help us be vaccine champions. Help us be vaccine ambassadors. Help us end this pandemic. We all need to end this pandemic. I think we're all tired. We all want to return to a normal life. And the vaccine is a critical component of doing just that.
So I think I speak for the entire Fulton County school system by saying, thank you so much for that awesome kickoff to our three-part series. And I'll just take the liberty just to say, again, 3 huge takeaways, Dr. Del Rio, for me, and I know that everybody probably listening to this presentation has their own takeaways, but 3 things that I just want to mention, and you certainly can, you know, add on to this, Dr. Del Rio, if you think of anything else. But I think 3 key takeaways. Number 1 is that we cannot afford to let our guard down. Even as we start to vaccinate individuals, we're not there yet, so we can't let our guard down. And then the second thing is that was a powerful demonstration and video with regards to herd immunity and just breaking down what that means. And how that looks. And that, again, that just reiterated the point that we're not there yet. And I think the most important thing was my takeaway, and I'm going to use this, so I'm going to steal this from you, is nobody's safe until everyone is safe. I love that. And I think that's critical for all of us to remember. And the reason why we felt that it was important to offer these informational sessions is for that reason, because we wanted to make sure that our staff had this critical information, that it's timely and that it's appropriate, obviously, as we are all making the decisions for ourselves and for our families about being vaccinated. So those were the 3 key takeaways that I had. But I want you to just, again, end, and then I'll share some other thoughts just from a district perspective. So I'll turn it back over to you, Dr. Del Rio, for your absolute final words.
Just say thank you, Lynn, and thank you to everybody listening. As I said, I think I'm very passionate about education. Our schools are very important. We gotta be, we gotta lead, and teachers are educators. They educate the community. So by you getting vaccinated, you are also being a vaccine champion.
Again, thank you so much, Dr. Del Rio. Thank you so much, Dr.
Thank you for
Carroll.
having me.
We really appreciate you taking the time out of your busy schedule, because we know tonight we might turn on the TV and you're going to be on CNN or some other national television station. So for you to have taken the time out of your busy schedule, as well as Dr. Carroll, to spend this afternoon with us, and we know you have to run, but thank you so much.
Thank you so much. Bye.
Bye-bye. So Fulton County staff, I hope that we hope that you have learned a lot from this presentation As we said, we have 2 other series coming up. Those 2 series, the next one will be featured on Monday at 12 noon, the same time. We'll really dive into some more information specifically about the vaccine and the Pfizer vaccine, which is the vaccine that we will be offering during Fulton County's Project Vaccinate 2021. And let me take a moment here to make that plug. Hopefully all of you as a Fulton County employee has read and seen the information from our Chief of Talent, Mr. Ron Wade, that sent out information to encourage all of you all. If you are interested in being vaccinated, we have that planned for you. It's easy to register. We have a barcode. We have information that you should have received in an email regarding our Project Vaccinate, which will begin the week of March 22nd. We have some exciting prizes and gifts and things for those employees that participate that week of March 22nd. It's going to be a great opportunity for you not only to get your vaccine, but just to get some small tokens of appreciation from the district. So we are excited about that. So again, going back to the series, we have our next one coming up Monday at noon, and then followed by that one on Monday at noon is the final series, which will air Wednesday. And we're doing that one in the evening because we definitely want all of our Fulton County staff to participate in that. After today, there will be a link that we will share. We're going to send out a survey link. On that SurveyMonkey link, you can go ahead and ask or comment any questions or comments that you would like for us to address in the next 2 series. So again, Monday's series is entitled What We Need to Know About the Vaccine, Special Considerations, Safety, and Post-Vaccination Implications. And then the last one, as I said, on Wednesday, it will be mostly an opportunity for us to just go back and forth with our 2 amazing presenters that evening, which is Dr. David Holland. Dr. David Holland is the Chief Clinical Officer or Medical Director for the Fulton County Board of Health. And Fulton County Board of Health, of course, are our partners to help, and they're solely responsible for helping us to pull off our vaccination opportunities in partnership with the Mercedes-Benz Stadium. And then our Medical Director, Dr. Yolanda Wimberly, will also be available to ask and answer questions during that Wednesday session. Monday session, we'll have Dr. Wimberly and Dr. Kimberly Manning. Dr. Kimberly Manning, you may have heard of, she's known across the world. She's been on Oprah. She has her own podcast. She knows any and everything specifically about the vaccines. So we certainly want you to tune in to that session as well as the session on Wednesday. I think that is all of our housekeeping notes. Again, we just want to thank you for taking the opportunity to participate. You also, if you have specific questions related to our Project Vaccination 2020 or our Project Vaccinate 2021, not series, but just the event, the actual vaccination event, you can email us at Project Vaccinate. You see it on your screen at fultonschools.org. We're happy to answer questions. If you have questions about registration, questions about accessing the Mercedes-Benz Stadium, any questions about the specific vaccination event, please send us an email to the projectvaccinate@fultonschools.org email address, and we'll email you right back with the answers to those questions or comments that you send to that email address. So with that having been said, have a great day and a great weekend. We hope that all of you all, again, will tune in on Monday at 12 noon. So have a great day and a great weekend. Thanks, everybody, for tuning in.